I would say one of the main challenges when we're talking about the treatment of children and adolescents with narcolepsy is the fact that they're not diagnosed. One of the biggest things that we're expecting is that because this is a pediatric onset disease, that we would see that children are the ones who are coming into clinic. However, we recognize that one of the biggest barriers is the significant delay in diagnosis. So although the most common time that we're seeing the diagnosis present itself is around 15 to 16 years of age, it's taking upwards of 20 years for some people to actually achieve this diagnosis. Why is this relevant when talking about the fortunate child who actually gets diagnosed around the time of their symptom onset? Well, the fortunate part is that you're actually able to intervene at a period of time that is so incredibly integral to the ongoing development and self-identity for the remainder of that person's existence. When we're talking about 15 to 16 years of age, I don't know if you remember 15 to 16 years of age, but I remember for myself, who does not live with narcolepsy, it was a period of not knowing who I am, what I want to be, how do I fit in, all of these really critical elements that lead to the identity of who you ultimately are going to be. If I now am struck down by a condition that is burdened by severe excessive daytime sleepiness, that leaves me marginalized and isolated, academic success is really the smallest component that ends up being affected. You end up with individuals who have no idea of how to potentially be the person that they have the ability to become. Never mind the fact that that social isolation and marginalization can result in bullying, can result in families thinking that they're on drugs or that there's something else wrong, teachers thinking that they're not working hard enough. And this is not even taking into consideration the remainder of the pentad symptoms, as well as the non-pentad symptoms, like the rapid waking that frequently can be associated, which further is going to compromise and cripple the self-esteem that individuals may have. When we look at the longitudinal effects of individuals with narcolepsy, we see that it carries a very large, not only healthcare burden, but a socioeconomic burden. Why is that? Because when I'm striking down a child in its critical period of time for you to undergo optimal developmental milestone acquisition, I'm striking down your ability to achieve your potential academic success. This translates into lower likelihood of higher education success, lower likelihood of their becoming the work productivity that would lead to higher earnings. So we see that a child who's impacted with narcolepsy results in far-reaching things that now you really need to wrangle with. The treatment of narcolepsy in children and adolescents needs to be personalized but holistic. We need to look at not only pharmacologic efforts, but also lifestyle, social, and psychological efforts to really treat at the whole patient. In addition, it's not just treating the child, it's treating the family, the parents, the school districts, making sure that there's increased awareness, as well as ways that can be supportive and actually affect the changes that lead to optimal success that is measured by more than just attending school and what grades are being achieved. I'm always incredibly privileged to be able to work alongside and with the Society for Women's Health Research. They never stop trying to evolve and move the edge on how can we empower women who not only may be suffering with disease, but may be caregivers for others with disease. In this particular effort, we're focusing on children and adolescents and how parents, such as mothers, are able to be advocates for their children. This is going to be a great event because we are able to utilize a variety of different perspectives. I'll be bringing a perspective of a treating physician and why we really need to have this personalized approach and how the delays in diagnoses and the treatment options we select can not only impact that child right then and there, but really the implications it has lifelong. I get the opportunity to partner this presentation with a psychologist who is an expert in school delivery, recognizing that those behavioral and lifestyle management skills can be utilized in a school setting, either through a 504 plan or an individual education plan. The other part of the event is going to be that we have a mother who has a child who has narcolepsy, and she'll be representing Wake Up Narcolepsy. So we not only get an individual, but also an advocacy organization who has been rooted in advancing how we're able to deliver care. I think the reason that you don't want to miss this event is because of the fact that this is going to provide information that is going to be transformational for not only if you're a clinician or a patient, but if you're in a community and you're recognizing that there are children or adolescents that have features that are consistent with narcolepsy, excessive daytime sleepiness that looks like mood instability, decreasing grades, withdrawal, hopefully will lead to increased recognition. I also hope that it reduces the stigma around children and adolescents who are going through this, as well as recognizing that it's not just the child who needs the support, but also the family unit, and being able to support mothers and fathers who are trying to provide the optimal care and delivery of education and resources are fully supported. We have to remember, it's not just a healthcare system that takes care of patients. It takes a village. The saying is there for a reason. It's true.